In this age of gender confusion, it's difficult to find advice you can trust to help protect your child from those who would seek to unduly influence them, setting them up to be manipulated and exploited. On Unmasking the Trans Movement, we discuss, educate, and deliver the info parents want and need to help their children, grandchildren, and even themselves.
Welcome to Unmasking the Trans Movement. Now, here's your host, Brad Wilder.
Good evening, everyone, and welcome to Unmasking the Trans Movement with Jon Uhler. I'm your host, Brad Wilder. Great to have everybody on board tonight. We've got a great show coming up. We're going to talk about multiple things, including part 2 of our key 9 red flags of clinical abuse and trauma and kids and sexual abuse. It's such a, I guess, such a diverse list of topics tonight that there's so much we're going to break down. There's things that parents and grandparents have no idea about that is taking place not only in their schools, but some of this is happening in their churches. We're going to get to a whole bunch of different things that are really going to educate you as to what's going on with this movement and how you can make sure that hopefully it doesn't creep into your family. It is creeping into families all across North America, but hopefully we can give you a little bit of information and guidance that's going to help cut it off before it gets too deep and through your front door. There's lots to come, including Dr. Gillies and Jon Uhler. They'll be up right after this.
Citizens and librarians alike have expectations for libraries, and well-run ones can be amazing for everyone. School libraries are often essential to educating children, and as such, special rules apply for the well-being of children in every corner of the world. The World Library Association aims to counter the woke American Library Association's efforts to indoctrinate and sexualize children and hide content from parents and grandparents. The World Library Association provides decades of experience with libraries, and we want to help educate and apply that experience to improve your libraries, whether you're citizens, teachers, librarians, and even trustees. Our common sense model policies comply with community standards, enabling libraries to become truly useful for everyone in the community, and empowering librarians to ensure they work in a safe work environment. The World Library Association. Have questions? We're always open to talk about your libraries, new projects, creative opportunities, and how we can help you. The World Library Association. See us online at worldlibraryassociation.org.
Welcome back to Unmasking the Trans Movement with Jon Uhler. I'm your host, Brad Wilder. Tonight, lots to come. Jon Uhler is standing by. Jon, great to have you on the program. Dr. Gillies is with us tonight, too. Dr. Ann, looking good on a Sunday night and all ready to help get these parents and grandparents all in tune with, so much that goes on within our world these days that is not only confusing to parents and grandparents, but our kids as well. And, this is our chance to help educate people, give them a little bit of understanding and knowledge into some of the things that are going on, not only within our own houses, but within our own schools, within relationships, within, our classrooms. So let's jump right in. Jon, what are we going to do? You left us on a cliffhanger at the end of part 1, buddy.
Well, as to Dr. Gillies, welcome back. You are the co-host. So good to have you back in the saddle. You've been all over the place as far as touring and book touring, and so we're going to be featuring a book of your one of many of your books here very soon. After we're done with this series, it's going to turn into a series. We're looking at the behavioral and clinical indicators of sexual abuse that are reframed, quite frankly, through those pushing the trans movement. That's why we're so concerned. But this is now going to be an ever-growing series. How can I say that? Because I'm looking at the content I'm dumping now into this. And it should be, I think, an extremely helpful series for parents, very practical, and educators and all good people, because, Ann, you and I are trauma therapists. So welcome back to the program.
It's good to be back, Jon. And yes, there's so much that we want to help parents understand. I mean, it's not the world we grew up in. It's not the world our children grew up in. Now it's the world of our grandchildren, my grandchildren, and even they are, some of those are already aging out of what's coming next. It's just, it's so insidious. And if we don't get ahead of it as parents and grandparents, as educators, then it's our children that are the ones that are being wounded, and we want to protect them.
Right. We will hear people cry conspiracy theory. What is that? First of all, that's from the Mockingbird media. That was actually a term used by the CIA, conspiracy theory. They actually created that, by the way. What is a conspiracy? It's two or more people getting together and planning and strategizing. That's all that is. The question is, would anybody have a vested interest in coordinating efforts and strategizing to get hold of vulnerable youth? Is that ever a target audience? Does that ever produce lasting value in terms of a lot of monetary gain and customers for life? And you and I are here to say yes. That right. Advertising has known that forever, right? They target kids with Nikes. They target kids with music. Who would have ever thought, though, and that they would target kids for sex change surgeries? That's bottom line. That's what this is. This is not transgender medicine. This is sex change surgeries and sterilization of kids.
And to get into their heads with cartoons yet, right? To get into their heads with the cartoon aspect, to bring that into play, and it's all relevant, right?
Well, and even now, the newest thing is eunuchs, right? So that we're actually castrating young boys, young men, so that they're eunuchs. Now, the eunuchs have been around for centuries, but this is a whole different ballgame that's happening. And, it did start a long time ago. It's been going on for decades as far as the trajectory. What we're seeing now is the outcomes, right? But there's so much that's been happening for many years that has really been setting young people in a precarious place, a confused place, where they don't understand who they are and don't feel right in their own bodies.
What's a eunuch?
Oh, there you go. Well, it's a young man that doesn't have his parts, Brad.
Okay.
Yep.
That I did not know. I did not know there was even a term.
Well, and we see that term in the Bible a lot, because when so here's a little educational piece. So
because we're also then going to talk about how deviant men have been pushing this on boys, and then that'll lead us to, we're going to do a little primer. And don't worry, we'll get to the rest of the 9 red flag indicators, but we're really going to help people. We're going to set the stage for parents and all good people to understand that the signs that you're going to see most prevalent in those kids that are transitioning all the way onto the moving sidewalk, dumping out on a surgeon's gurney, are more than likely they've been sexually abused. So we have to understand, how do you groom kids to where once they've been perped on, they'll never blow the whistle on it?
Yeah, exactly. Well, to answer Brad's question about eunuch, let me go quickly. Eunuchs were often, young men were often conscripted into the king's palace, into the king's service after the king had taken over another land, right? And so these young men, usually the most intelligent and very good-looking young men, were castrated, and so they could be in service to the king. That was, these are centuries ago, right? But that nothing's changed in that sense, and there's always been some kind of weird deviance. But what we're seeing now, that was totally different than what we're talking about today. But anyways, that was to Brad's.
There's just probably
question.
Some people might not know that term, right?
Well, no, you're right, absolutely. But that is part of now. And I was talking about this earlier to John, that because he was saying we're dealing with a couple decades, and I'm saying no, this has gone on for more than a couple decades. And what people don't understand is the whole queer theory theme. And so a woman by the name of Gail Rubin in 1984 published a document. And the central theme of queer theory, which people are hearing a little bit about now, is to challenge the normal assumptions about sexuality. that, number one, sex is between a male and a female, so you challenged that. But she was really the first one that advocated for inclusivity and diversity in sexuality. So this is 1980.
And that's why there's going to be that overlap in schools, diversity and inclusivity, right? And Alvin Louis does a wonderful job speaking to how they capture language, they play upon our empathy, but DEI, diversity, exclusivity, inclusivity, and all that crap, right? They go hand in hand because it's dumbing down a child's intuition.
Yes.
And making it easy prey.
And Rubin was all about questioning societal norms, right? So anything that was normal. So queering basically is to take the normative, the natural, what we see every day, what we know to be true, and turn it upside down, queer it, and teach the children how that black is white is black, what, 2 and 2 equal 5. Like anything that is not true is like queering. It's so incredible.
And that's what a predator uses. Predators will use that. As a matter of fact, Dan, I want to recommend people access a woman by the name of Genevieve Gluck. We won't play this just because by virtue of time, but I would highly recommend you look up Genevieve Gluck. She's part of Redux, and that's just one of many videos she has done on the eunuch archives. What they found were the perps and perp apologists involved in WPATH. Many of those key figures early on were into what's called the eunuch archives. That was a very clandestine group. You have to be allowed in. And those are very deviant men that have gotten into heinous sexual stuff, including castration of boys and also eventually snuff. So
without anesthetic, by the way.
Yeah, I'm sorry?
With castration without anesthetic.
There you go. So you have to understand that the trans pushers have used the trans movement as the ultimate Trojan horse to finally get into and then come out in as far as what their ultimate agenda is. And their ultimate agenda is financially and sexually preying upon kids.
Yes.
That's what this is. It's the exploitation of kids, and women are the necessary fallout, and hence the eradication of women's sports, because the guys want to get into the locker rooms, men in women's prisons. It really is the ultimate war on parental rights and women.
And the other thing with this, too, is that, like Rubin, going back to this Gail Rubin and the queer theory, because it all ties together, her discussion, she brings into this whole thing that the taboos and moral panic over boy love, and that all of that should be normalized. So child rape, boy love, so homosexual pedophilia, which those two words are never to be used together, because that just is taboo, right? But let's call a spade, and that parents overreact to sexual abuse. What do you think, John? Is that true? Parents overreact?
Right. Who's the only category of people out there that are going to minimize the harm of sexual abuse? It's those that want to prey upon kids, or those that are organizing others. Wherever you find a Jeffrey Epstein, you're going to find a Ghislaine Maxwell. Wherever you find a Keith Raniere of Nixium, you're going to find an Allison Mack. When women are involved, they are useful to allowing the men to gain access. A lot of times when we find massage parlors, as bizarre as it is, you will see women that are the ones recruiting the young gals, and that's going to be a man involved in one way or another. So whenever you see prostitution busts, inevitably there's a greedy woman involved. It's sick, as well as sexual deviant.
And that's one of the grooming, when we talk about grooming, right? And the key indicators, the luring is part of this. So we need to, wake up and think, okay, how it's, to me, getting my head around women being so instrumental in this has really been difficult over the last 20 years, because, usually women have a strong maternal and protective quality, like their hearts are to protect. So that has to all be overridden, and it's done through manipulation, also another predatory tactic, manipulation, confusion, terror, we'll kill you if you don't do this. It's done through self-preservation. But yeah, it's devious and it's convoluted. Anyways, back to those.
There you go. So what we're doing is we're setting the stage for it, because it occurred to me, unless somebody really appreciates the danger of the trans movement as far as the ultimate cover for the predation of kids, then they're not going to take it seriously. So there's a rainbow flag at school. So where it's all inclusivity. But if you don't understand that when you see that rainbow flag being flown, when you see drag queen story hour in libraries, if you don't understand that your boundaries and your ability to discern is being tested at that moment. Somebody's testing you, testing the adult. We need adults in the room. And so that's why it's really important to, as we continue looking at the indicators, we can show people the indicators right now. But if you don't really think that it happens in there, it's like people in churches, right? They are concerned about people in churches is we think, it happens in the groups outside of us, but not in our backyard, not in our home, not in our church. So people need to understand where predators lurk and what's behind it, what's the motivation. So I thought, since you brought up queer theory, and we are going to get into the red flags, but this is so that you can meaningfully see the red flags, you have to see where the predators are going to congregate, as it were, like sharks. Where are sharks going to end up trolling? Okay, and what's setting the stage for it? Because if we were lifeguards and we kept having kids get consumed by white sharks, we might want to rethink how we're thinking about. Maybe we finally ought to raise that flag saying beach closed.
Listen. So you are just tapping into something that's happening in Toronto this summer in nude swimming, in the public pools, nude swimming, and children 14 and over do not have to be accompanied by a parent.
It's a serious, right? They had a little flyer out there, nude swimming, 14 and under, but parents not permitted.
Parents, and that's not quite true. Parents are permitted if they want to come, but children can come on their own, and we have to remember.
The parents have to be nude. It's all nude.
Oh yeah. If the parents go, they have to be nude. It's all nude.
They had a picture of a pizza on the
interesting. Isn't that interesting? And just for people, give them a little bit of an idea what that's significant of. Because
in fact, we're going to be covering that in depth. But predators and pedophiles will use symbols. They will talk in certain. They'll use certain key words. Why? Because they love playing the public for fools, and they are communicating with one another. There are certain emojis or certain little symbols that are indicative of pedophiles and their age preference and gender preference. And so pizza is one of those that references kids. There's others. Chicken is one. We will go into what parents also can watch for online. When you start to see that, and it's a very real thing, then you're happening upon deviant adults that are targeting kids, and they're communicating to one another right out in the open in plain sight.
Mm-hmm.
So, and to set the stage for it, because I do want you to talk a little bit more about queer theory so parents can understand that the trans movement just didn't come out of the blue. But what I thought I would do is we will play a little excerpt from one of our previous guests on unmasking the trans movement, Ed Sparius. He's referencing a study that I was able to participate in. You know what? Let me get out of this, make sure I did this right. We're going to get the sound. Okay, we got sound. And we're going to show an introduction to the issue of the grooming of kids. Where did that come from, and the role that Kinsey played in it? Let's see if I can get this right. Have sought to limit any discussion, any providing of alternative information have used this term, used this phrase, really ultimately to limit choice. And Ed, thank you for joining us. You are from Australia, so I should say good evening from North America, but good day down under. Thank you for being here.
Thanks for the invite, John. Really appreciate it.
And Ed, you and I have a mutual friend, Dr. Elizabeth Taylor, not the movie star, but a brilliant woman.
This is a little bit of history, a departure into history, but there were two twins, and the story, there's a tragic story actually, the Reimer twins, and they were having surgery on their genitals when they were very small. They were 8 months old. It's often said that it was a botched circumcision, but I think it was some urological issue that was being corrected. Anyway, and the surgical instruments failed and mangled the penis of one of these boys so badly that they were referred to John Money to find out what could be done. And he recommended that because this one particular boy had been so badly damaged, that it would be more kinder to feminize him, to cut off the and to turn him into a girl. And as long as he was affirmed as a girl and never told that he had ever been anything other than a girl, then this was thought to be an entirely satisfactory way of treating this child. And every year, Dr. John Money would check up on the family, and he would write a report that was published very widely in international medical circles about the success of how Brenda was developing beautifully, and Brenda liked to keep her room tidier than her brother, and all of these gender norms were playing out until puberty hit. And then Brenda became suicidal and depressive until eventually her parents decided to tell her the truth. Now, Brenda to re-identify as David Reimer, and it was in adulthood that he and his brother revealed that John Money had done some things which are really very highly questionable to them as children. So he'd obliged them to take their clothes off and to mimic sexual positions with each other, and had taken photos of this. And when he was questioned about this later, he said, well, this was so that they could learn the correct sexual behaviors with boys and girls. So this is two twin boys, effectively. Anyway, so they were traumatized by this, and they both, in adulthood, committed suicide. The brother who hadn't been operated on became schizophrenic, and he killed himself first, and then David did later. But before he did, they went public and they explained everything that John Money had been doing. Now, in the meanwhile, once David decided to identify as a boy, he was not going to have anything more to do with John Money, and so he told his parents that there was no way he was going near John Money anymore. Now, John Money every year had been informing the medical community that his experiment was successful, that actually he had proven through this experiment on unwilling human victims that gender was entirely a matter of nurture and nothing at all to do with nature. And he never corrected that in the international record. So when David said, no, when Brenda stopped wanting to be Brenda, John Money never corrected that and said, look, guys, stop. Sorry, it was all a terrible mistake. So that gave rise to sex change surgeries. In fact, that was John Money was working at Johns Hopkins University Hospital, and this was where all the sex change surgeries started.
She was the person to connect me to Judith, the late Dr. Judith Riesman.
So how did we get here to where we're at today? Because I don't think pornography has always been such an epidemic cancer within our society like it is today.
No, not at all. We were, up to the end of the Second World War, a conservative Judeo-Christian nation. The turning point for all that was Dr. Alfred Kinsey, his book, Sexual Behavior in the Human Male, 1948. He was the father of the sexual revolution, and therefore the father of everything that has come from that. And certainly one of the key things was pornography.
Once a biologist who studied gall wasp, Kinsey's obsession with sexuality led him to found the Kinsey Institute for Sex Research at Indiana State University. What people to this day are not aware of were the methods he used to collect his data.
And I looked at the graphs that he provided, 30, 31, 32, 33, 34 tables, and I said, wait a minute, that's a 2-month-old baby. How does he know a 2-month-old baby did or did not have an orgasm? And then table 34, a 4-year-old child, 26 orgasms in 24 hours. That's an around-the-clock experiment.
Wow, that's torture.
That's torture, you bet. He also actually employed bona fide pedophiles to do what they did to children for his so-called data.
Kinsey wanted to prove that we are sexual from birth.
And you decided, and so we'll set the stage. People can see, I might as well hold up here. This is what we're talking about. Turn that off. And what's, okay.
Well, this is my pet, right?
So again, people can see, we want people to be able to see that in order for us to meaningfully identify and see the red flag indicators, we have to see there's a problem, there's a threat. So in those waters of what? Gender affirmation, all this, the context allows for the predators. So this is the perfect way to dumb people down, dumb adults down. So it's been happening for 20 years. And now we don't even know what we're looking for, including professionals, and it's horrible. Mandated reporters and teachers. Nobody knows what to look for in terms of those 9 red flag key clinical indicators of sexual trauma.
Well, and that's why
I was talking without my mic on. Sorry about that.
Oh, so. I can hear you.
Good.
But yeah, and what you're talking about, the 20 years within the trans movement really getting going. But, you know, when we talk about Kinsey in 1948 and his study, and I go in depth in that and closing the floodgates and talk about Judith Reisman. But, you know, so the whole predator and the aspect of pedophilia that came out of that between and porn, they mentioned porn as well, because Kinsey and Hugh Hefner were like this, right? And so one promoted the other. Kinsey's assistant, Wardell Pomeroy, who became a clinical psychologist. So people need to understand that coming out of academia, this isn't every psychologist. Please hear me out. But there are some really evil people in the humanities, and it's gotten worse. But Wardell Pomeroy was a clinical psychologist. And in 1976, let me read what he says. Incest between adults and children, younger children, can also prove to be a satisfying and enriching experience. Hello, what's he talking about? Incest, pedophilia. And he says incestuous relationships can and do work well. This is Kinsey's assistant. This is 1976. And, you know, he's had, by that time, 20 years of practice, and it just gets worse. And so academia became more and more respondent to this. And so psychologists, psychiatrists, and especially now in 2024, we're seeing a whole raft of people graduating who believe that pedophilia should be an orientation. And so then you have the whole trans movement that feeds and funnels these children. And because they have already, perhaps many of them have been sexually abused, they already have several vulnerabilities, they have mental health issues, many of them, they are so easy to become prey for pedophiles.
There we go. And that's really why we're taking the time, once again, to help people understand. You really do need to know where you're at. What, are there sharks in that water, in that beach? Is that the beach you really want to just let your kids go play in? And our contention is the sharks are going to go where the hunting is best. That's why you have perpetrators, predators in churches, in wherever you're going to find kids, but especially anything to do with sexual deviance. And the trans movement, as we began looking at highly sexually deviant material, pornography is being used to groom the minds of kids. Brad, do we have any questions or comments at this point?
Well, there's always lots of people coming online tonight with us. Big Island Beach is here, as well as Pretty Weird Duck. Say hello quickly to, there was another one up at the top here. I've got to scroll back. I've got this new setup here that allows the comments to come right up here on our screen a little differently than before. Tim and Miranda are here as well, so A few people online with us tonight. Big Island Beach says, I'm currently taking the Annika Lucas Shift the Power program on her unconditional model. Have you guys ever heard of that before?
It sounds familiar, but we'll have to look into that. If she wants to send us some of that information, or Annika Lucas, that sounds really familiar. My apologies. I bet I'm familiar with it. That may have to do with exploiting child exploitation.
I wanted to ask you a quick question. I mean, there's not a lot of questions on here tonight, but one of the ones I've got is Kinsey in Canada?
No, U.S.
U.S.
The University of
Indiana.
In Indiana.
They still have the Kinsey Institute now.
And they just built a monument to him and erected it last year or the year before. Like, come on. He is the one who brought in the sexual revolution and everything sexual and sexually abused so many himself. And they put up a statue to him.
He brought in the sexual revolution, the deviant sexual revolution, or the sexual revolution? I thought Hugh Hefner was the big part of the sexual revolution.
Yes, well, Kinsey and Hugh Hefner were very good friends. And so Hugh Hefner did the porn, right? And then Kinsey did this fraudulent research and supporting the whole idea of pedophilia. And when you talk about the sexual revolution, that came in the 60s, but it was already gaining ground. And the sexual revolution, there's not really much that is good about it. I mean, some people think, oh, that was wonderful. Look at it. Give us all this freedom. Yeah, there is no free sex. Hello.
Right. And you look at all the stats, right? All the social ills, everything up from that point, including fatherlessness.
That
is a key.
STDs, which I think there were like 4 or 5 at the end of the Second World War. And then, in the 80s, 90s, 25. It became, it's an epidemic, and AIDS, all of those things. So we can go on for, let's stick back to the.
We'll get back into, again, now what we've done is hopefully we've helped parents see that this is not, it just didn't organically come about, the trans movement, that there's been a lot of tilling of the soil, and Kinsey was a part of that, changing the sexual mores, and those people haven't gone away. And so we really want people to understand that what they're seeing has been in play for a long period of time. We're going to look at some of the stats again. I've added to those just so people can see. Again, we looked at how long have there been trans? First of all, there's no such thing as trans. There's male, female, boys, and girls who are confused. That's all it is. So we looked at a lot of stats that show there's flat line prior to the year 2005. Guaranteed. There was no such thing with the publishing of the DSM-5. And again, we call on those that were involved, the 13 individuals, Blanchard being one of those, to step forward, and Zucker as well, step forward and repent publicly, saying we didn't realize, even though we're bright people, we didn't realize that with the publishing of that book, what was going to happen? That book. Yes. So it made all things billable. Look at what was going on with the red volume, the DSM-4. Everything was fine. You suddenly you manufacture a new diagnosis. And what happens? Now kids are going to pay the price, literally and figuratively. Now, we also wanted to see some of the additional influences so you can see it's not just the APA. And again, what came from all of this? Look at the look at the jump. Okay, this has to do with double mastectomies, right? Cults will toy with language. We're going to use accurate medical language. Young kids, first of all, prior to having breasts removed, they've already been put on puberty blockers. Therefore, they're already being sterilized. Okay, this is the ultimate eugenics dream come true, number one. And then you're going to chop off body parts. Surgeons, like evil surgeons, Nazi doctors like Dr. Gallagher out of Miami, she can pay cash for her yachts. You look at the stats and they say, well, it's not happening to kids. Really? Look at the ages of that.
13, look at that.
Early as 13, People are giving kids, these evil doctors, double mastectomies. What other influences would there be? We had Jazz Jennings. Look at the jump. But again, without the DSM-5, none of this would be possible. 13 individuals need to repent publicly, and they won't. And it's pathetic.
And see, John, after that, you see, we're looking at 2013, 2014, and then the whole social media convergence, everything just started to converge. And
Right.
we have all of the predatory things that are happening through social media. Not only that, these transing websites so that children, get directed to these websites. And
Right.
so we have predators instructing children how to transition, how to, get the right doctor and get the right psychologist and get the right, pills.
That's right. I mean, this is a black market as well. It's diabolical. So the one thing I want parents to see is look at the graph. And this is the world over. This is worldwide. Again,
Yes.
Look at the numbers. So prior to 2005, there was nothing. There's another one. Nothing. Okay, this is not our imagination. This is fact.
Yeah.
This is contrived. And what goes along with who's going to sign up to have their sex organs removed? Troubled kids. And as we saw last time, suddenly, and my guess is if we were to see a graphic of all the other kinds of drugs, we would see an uptick there. So 2013, I would recommend our viewers, and if they want to send us graphics, show us the work you've done as far as what happened in 2013. So a lot of influences we talked about. We're not going to do watchful waiting because that just gives predators time. We're going to get into what happens within a man to get to a point where he's going to sexually offend. We're going to do that because we're going to look at your book, and it's right around here somewhere. But you want to give the title of it again? My apologies, it was just here. But we're going to begin to look through your book. Would you remind us of the title of your book? Although I bet I have it here.
You're talking about Damaged by the Predators?
There you go, Damaged by the Predators. I don't know if I have it immediately with. So we're going to be reviewing in a number of weeks the mindset of predators, so people can be aware of that as well. We're also going to look at some of the tactics. Okay, but now we're going to look at we're going to pick up where we left off, but we're going to kind of camp a little bit more on the behavioral indicators. So that's going to be very important. We looked at, and this may not necessarily be an order of priority, but yes, it is, quite frankly. So, but these are high up there. So you look at a child that is in distress over their actual sex. You used to call it sex, now gender, but suddenly a girl does not want to be a girl, wants to be a boy. We touched on these last week. And you want to speak to any of that or jump in as I'm...
Yeah, I think that's pretty self-explanatory, and I'm glad you clarified. It's not gender; it's sex. This is the craziness of the language and how it's been hijacked, so that we have the confusion that's happened with these young children. Let's get back to basics, biological basics, and a child is either male or female, and then they decide that they don't want to be the sex that they were born into. So, and that all comes through when we talked about many, many different things, sometimes because they've been abused sexually and they want nothing to do with sex, and they can have more power perhaps if they're a boy. They think this is all in their mind, but they think they identify more with being a boy because perhaps they have not a good relationship with their mom. There's so many different contributors, and everyone is different. So there's no cut and dried. I don't see any cut and dried for everyone. It's not the same, but there is this.
That's right. But oftentimes with sexual abuse.
Yeah, sexual abuse can be a real indicator. Mm-hmm.
There you go. So one of the indicators of a possible, if not likely, predator is a man that shows a very a unique level of interest in kids, being around them, by himself, and their sexuality. Welcome to the trans movement, those that are pushing this. Okay, so what indicators? If we have a kid that suddenly starts to show these, parents need to be mindful. So when a child says, I don't want to be a girl, I wish I was a boy, does that mean 100% they've been perped on? No, but you better, so enough of these. So what we're going to see are, again, the behavioral indicators, then we'll go into the clinical indicators. These all matter because where there's smoke, there's fire. So the first one was discomfort with their body. And again, what kid isn't comfortable in adolescence? But that's different than saying, I want to eradicate my body so much that I even want a dead name. That's very radical to do. The second indicator is serious self-harm, so self-injurious behavior. A lot of different terms for this, self-inflicted violence, different terms, but there's cutting, then there's cutting. And so you see the cutting or burning, as we talked about last time.
Very significant.
There you go. Okay, I've added some additional things, and again, hopefully this will be helpful for parents, educators, and all good people. And you and I both are trauma therapists. You're a complex trauma therapist, and we have worked with damaged teens, with teens that have significant emotional issues. So people can submit questions to us on the program. So here's another thing, and you want to take this one?
Yeah, so the changes related to education, they're in school. So, and sometimes it's, I don't want to go to school. And they all of a sudden, they'll be sick a lot. I'm not going to school. I feel really, really sick. There can be a drop in grades, change of social groups, or totally isolating from social groups that they've been involved in before. And then the whole sense when you've got this really well, because starting certain activities, and this is where a child who has, like you said, been perped on is very vulnerable, because they have a lot of insecurities. If they have been sexually abused, there's this whole sense of insecurity. I don't belong. Something's wrong with me. Well, guess what? We have a program for you. Like, that's not what the child's saying out loud, but they manifest it in how they behave and certain things that they say and do. And teachers can pick up on that pretty quickly, that something's happening. And what we have in our education system now is teachers that actually are opening the door. And more than that, they are prescribing certain clubs and activities for these kids. And I'll just say it out loud, Gay Straight Alliance is one of those, where these children who, a lot of them have autism issues. They have some other pre-existing issues. They don't fit socially. And so here you go. This is a place where you're going to fit. Everyone's going to love you. Well, that's right.
The predators, the adult predators, are waiting with open arms. It's like a little Red Riding Hood. The wolf was a cross-dresser. Okay. So number one, and what's important is the more of these red flag behavioral indicators that an adult sees, a parent sees, then it becomes all the more likely, because these are profound. Yes. Something has happened. So what's going to create the most emotional distress? It's going to be sexual abuse. That's going to show itself in behavior. So we've got number one, a teen that doesn't want to be their own sex or gender. Number two, we've got self-harm. Number three, changes related to school all of a sudden. Number four, overall concerning changes. I really like this graphic. It came from wavelengthpsychology.com. I put the little attribution down there on the bottom. I like this graphic. So Anne, you want to walk us through this?
Well, you're covering just about everything, but I want to go straight to the physical, because parents often see this before they understand even the academic or the emotional. And so that's kind of where I was going before. A child may not want to go play with their friends, or they won't want to go to school, or they'll have physical concerns, and here you have it. headaches, gastrointestinal aches and pains, excessive fatigue, if your child is really tired all the time, changes in eating. So we talked about that last week. We had a question about that. So you have binge eating or you have anorexia. And those two are probably the highest level of indicators of sexual abuse, because it's something a child or adolescent can control. And they want to try and gain some kind of control over their body again, because they haven't had control, because it's been lost to a perpetrator, to someone who has sexually abused them. So changes in eating, difficulty falling asleep and staying asleep, all of those. Often, the other thing, I don't know if it's here, I haven't seen it, but bedwetting. That's a physical thing that often the children will manifest. They'll start wetting the bed, and they're older, and all of a sudden they regress. Nightmares, panic attacks, those are, pretty obvious. So parents can really begin to watch for some of these things. And remember, when we say this, that just because a child has a headache doesn't mean they're sexually abused. So take this, we're trying to give you a lot of information. But when you have a series of these things happening, the physical, the academic, feeling overwhelmed, no, that's something that most children now, there is such a level of anxiety within children in our society, and it doesn't necessarily have to be sexual abuse, but my theory is that so much of it is the confusion that they're teaching the children in the schools, which actually is abusive in itself. But you have emotional things happening to your child. If you see these things happening, you need to get that child help. And, the first thing you need to do is just sit down and talk to the child and just begin to ask them what's going on. And, some children will clam up. And a lot of times children will deny that they've been abused because they've been threatened or they are embarrassed. But, getting them some help and making sure that you don't let this go by the wayside.
Dr. Ann, how do you go about helping somebody in that situation? What kind of advice do you give them to getting the help that they need to help them through that? Because, these are tough conversations to have. And it's tough to have a conversation to start it off. You could have it maybe, but how you proceed with the conversation is really important, because you're not trying to necessarily talk down to your kid. You're not trying to necessarily allow your kid to educate you. You want to have a point as a parent to make. So how do you start that conversation off? They've been groomed already. These kids are somehow more smarter than us. We were never talking about this. Our parents would never talk about this kind of stuff. There was never this kind of input that you trauma therapists have been able to decipher from all the shit that's gone on, pardon my language, over the past 20, 30 years. 40 years. Well,
you're asking a really good question, Brad. And let me say straight out, I didn't do it right with my children. I didn't know the signs. I wasn't trained. I was a mom. And that's a whole other story that we can talk about another time. But one of the things that I encourage parents to do is just keep talking to their children, have that relationship. You want to have that secure attachment relationship that you can spend time with your child, and the more you are invested in their lives, the more open they're liable to be. Where that really falls apart is incest in the home, and that makes it really, really difficult. I would say that that's probably the most difficult, because you have one parent that is perping on a child, and usually the male, and the mother often is totally unaware. And I know you might go, how could they be unaware? But these are master manipulators. And so that's why I didn't know of these signs, 40 years ago. I wish I did, because my children had many, if not most of these symptoms, but we didn't know, Brad. And so now, we've made some progress with the area of sexual abuse and understanding the signs. but to talk to the child. And if you are having struggles, you're seeing all these things manifest with your child, you need to take them either to a doctor or to a counselor. And
it's not going to reinterpret these as the need to be transitioned. That's right. That's our concern right there, Anne.
Yeah. Well, I would say with this area of sexual abuse, if you come at it like this, most of them, if the child isn't in this place of transitioning, most therapists will hopefully know the behavioral indicators and begin to hopefully help that child, a play therapist or something. But I mean, there's some different things that you can do, and just I think it's creating a place where your child is able to just talk to you, to ask questions like, what is it that's happening for you? I'm so concerned, I'm concerned about your health. If it's an older child, you're feeling all these things, what's happening at school. And get them talking, get them dialoguing.
Now, not all therapists do trauma. So would you recommend a trauma therapist before going to just a therapist?
Oh, absolutely. And John, that's for you too. Now, play therapists usually are very, with play therapy, they usually are very trained in trauma. Because
trauma informed. But what's so sad is that within all the training institutes for grad schools now of professionals, so therapists and also doctors, right? Because they've been captured by the woke ideology. And that then ushers in the trans stuff. Now you have these professionals that are going to see, it's one thing with a younger child, but what happens if you have a mother who is one of these mothers that want their kids transitioned? The one thing they're not going to permit, or when these therapists are working with an older kid, right? Either for fear of that they're being accused of conversion therapy.
Yes.
To begin to explore, and that's what this takes. No kid is going to come out and say, I'm being perped on. And that's where you can see in Canada, with Trudeau, in the US here, the Biden administration, look who they have, Rachel Levine here. Right. The last thing they want is for a therapist to begin to really talk to a kid and do that normal investigative work to help the child come out with it. What is going on? So they want to fast track these kids into a quick solution. And because a child is troubled, in this case, they're very susceptible they're already being groomed at school mentally and emotionally. And so the last thing they need, but the first thing they're probably going to encounter, is somebody that can whisk them off to Planned Parenthood and get them on cross-sex hormones.
Yeah, and I think what we have to be is so careful. And I think there are really good therapists out there, but for parents, you really have to ask the right questions, which basically is that you need to do a little digging about trauma. You want specific care for your child. You want your child, you want perhaps to say, I'm concerned about sexual abuse, and make sure that the therapist is kind of aware of that.
And you kind of talked about the hijacking of the language earlier, and Alvin Louis does all the time, but that's part of this. Make sure you use your words correct in that situation, because if you don't, that is where you're going to be speaking on a different level to these people, and they're going to be thinking you mean something totally different than what you actually mean, right? There's a confusion there that's being created. And these therapists, they're not going to tell the parent sitting there or the grandparent that, hey, I know what you mean, all right?
Well, go ahead, John.
No, keep going, Ann. You're doing.
When parents, in my practice, and I know everyone practices differently, but I didn't see children without their parents. I might see the child once or twice just to, find out a little bit more from the child. But typically, parents and children should be seen together. I think it's important because I think the parent needs to be heard, and there's so much misunderstanding that happens in family, and you want the parent to be able to communicate with the child as you're going forward in all of this, and you want the child to be able to express what's going on, not only to the therapist, but to the parent. So, look for family therapy, but that's focused on trauma. And I think that's really kind of where you need to kind of go. And there are some therapists out there. So keep looking. It's not impossible. And certainly they need to be trauma informed.
Yeah. And what I would say, and what just came to mind is, and we have addressed this in the past, if you're a therapist, and so I'll kind of flip it now, if you're a therapist and all of a sudden you have a parent, especially a teenager or something, that insists on being in all the sessions.
Well, that's another issue. Yes.
That's a different issue, but there's kind of an indication that, okay, whoa. So I have a parent that is wanting to overhear basically every single thing that's being said. Yeah. So we need therapists that can use discernment on both ends of the continuum in order to find out, is a kid being unduly influenced? Is a kid being perped on? And where is that perpetrator? Because oftentimes it's going to be right in the home. And then, of course, the kid is never going to say anything if they're sitting right.
They will never say. And they won't say anything with the parent there if there's perping happening in the home. They won't tell. And so you don't get very far. So I think, you have to look at every situation singularly and just take it one step at a time. And small children, I didn't work with small children, but I did work with, families and children who had been sexually abused outside of the home. And parents need to know how to then help that child really express what's going on and deal with the anger and the pain.
So, John, as we get closer to wrapping up here tonight, what number are we on in these 9 red flags? Whereabouts have we moved from?
We're not purposely teasing anybody. We wouldn't do that. We got to number 6, clinical. That means what's going on the inside. But then I realized there's so many more behavioral indicators. We'll look at 2 more. Unless there's any questions or comments from the audience, so to speak. Brad, is there anything?
No, I mean, we're coming up to our hour broadcast, and I'm thinking, I don't know whether we wrap up here or whether you want to keep going. It's your call, John.
Well, let's wrap up for tonight. We'll do part 3. This is going to end up being a series. And, instead of me trying to cram all this, I say we do a really good comprehensive job for parents, because when is the time that they will have 2 decent trauma therapists that have lots of years of history professionally working with troubled teens. They have that with Ann and myself. So I figured, you know what, we're going to do the right job during the series, and then we'll also make that transition into what to look for as far as the perpetrators. So we'll just continue. So we're part 3 next week, and we'll see how many parts. We may have another book that Ann's going to write from this, and I'll collaborate on a book from this.
That's good.
Well, okay, Big Island Beach in our chat says it's very important that you're doing this series, and all of the people in our chat tonight, from Pretty Weird Duck to Big Island Beach to Tim and Miranda, I think it was, they all are very appreciative of you guys participating and doing all of this work that you're doing, because they're not only learning a lot, but the people that watch the episode on a repeat after the fact, we've got big numbers there. They're not necessarily always with us live, but we do get the views after the fact, and those people are getting the education that we want to see them get. They're getting the information and the help that they need to hopefully make things better in their own lives and help them, I guess, attack the movement the way that it needs to be approached.
There you go. So we'll say we're doing the key red flag behavioral indicators. So we'll do those, and then we'll continue picking up on the clinical indicators. So the first thing that parents are going to see is what we're covering first. Yeah. So number 5. So again, we looked at just quickly a child that suddenly doesn't want to be the same sex or gender, but in a radical way. Right? It's different than adolescent discomfort with one's body. If you go so far as to want your breast chopped off, there's serious issues, and that's why we looked at this gal before. Look at all the self-harm indicators. So you can see then she's got one indicator, two indicators. So there's self-injury. She's going to have changes in school. Any kid that's going through that is not going to be doing well in school. So that would be indicator number 3 on this gal. She probably has a lot of other changes. There's going to be number 4, may start getting into drugs. And this is inevitably a telltale sign.
Oh, huge. And that's all part of the process for these children. Once they get into these groups, or they get online groups at Reddit or Tumblr and those kind of online platforms, this is really encouraged. And the children get around other children.
Testosterone acts like a drug within the young girls' system, quite frankly.
Oh, yeah, absolutely. And so, the whole idea of big pharma, and this is drug and alcohol use, I mean, it all goes together, and it's just so destructive to the child. So watch for that. If you're a young adolescent, or even 11-year-olds, start experimenting with weed and alcohol. It happens. And so you want to get to the bottom of that really quickly.
Okay, we're going to do another indicator of, again, a behavioral indicator. This one's packed with things. We'll end with this, but we're going to add more to it. This is so important because inevitably you're going to see a child who's being perped on. And again, where are more perpetrators per square inch? We've got them in churches. We got them in the trans movement.
And the schools.
And schools, right? Where's the trans movement? Schools. So parents, it's like taking your kid to the beach. Right? If you see a beach that, a white shark or a shark can show up every now and then, but if you knew there, we've all seen video clips of a drone flying up and over the waters and what you couldn't see on the surface, all of a sudden you see, oh my gosh, that water is filled with sharks. And so what we're trying to help parents understand is the trans deception is filled with sharks. And so you're going to take the most vulnerable and wounded kids that already give an indication of having had sexual abuse, and now you're going to let them play in those waters. It's guaranteed that they will meet a predator, 100% guaranteed. So here's another thing, along with the drug use, along with behavioral changes, we're going to see, and depression, so that's caving in, and we will see in kids oppositional and defiant. In clinical terms, we say op-defiant, but oppositional defiant, and then antisocial. We don't diagnose a minor with antisocial personality disorder, but antisocial activity. So by the time a child is doing antisocial things or op-defiant, he or she is well on their way to very difficult things ahead of them.
Well, and I just want to interject here, John, because here you have the oppositional defiant, but let's go back to Gail Rubin in 1984 and the whole idea of radical queer theory. It was to turn everything upside down and basically to take whatever was normal and make it abnormal. But the whole process of that is also to push this oppositional defiance toward parents. And so, because parents tend to be quite normative when it comes to their children and raising their children and what to do and what not to do. And all of that with queer theory is supposed to be thrown out the window. So we're actually training their children now through these generations to become more oppositional. And you see it every day, the disrespect. So that's different than what we're talking about here. But it becomes the muddied waters that we're seeing. It makes it so difficult, like you said, John, to actually now identify children, which ones have been sexually abused and which ones haven't, which are just being so coerced into an ideology that they are becoming oppositional to parents. And I mean extreme opposition and disrespect. And there's a whole other thing that goes along with that. Sometimes the gentle parenting, and sometimes it's so complicated. What makes it hard for parents today is the complications. And I think what we want to help is parents understand, okay, what's going on with your child. The more you're able to talk with your child, more open they are. And that starts right from the earliest years. You want to develop a secure attachment with your child. And that will create an atmosphere where they can talk to you about anything. And hopefully parents will continue to do that.
There we go. Well, Brad, we'll stop here. One thing from that previous slide, a significant indicator, especially with younger kids, that sexual abuse is happening, again, is wetting oneself, soiling oneself, so enuresis, encopresis, and fire setting. Those are three indicators. Frankly, if you see it in teen boys later on, you'll also see cruelty to animals, so harming animals. Once you get into that, especially, well, even more profoundly for a girl, to be honest. But when you start to see that kind of behavior, you're dealing with really serious issues for boys, all the way up to the potential of he may become some of my former clients in sex offender treatment. You can have a serial rapist or even a murderer at that point. So these, we'll go into that a little bit more. It's a difficult topic. We won't go into it in this series, but again, we need to be able to see the indicators, the warning signs. And unfortunately, what the trans movement, what the pushers of all things trans have done, is it's made it very difficult, almost impossible for therapists to do an adequate job and to be able to see what is behind the surface.
So before we wrap up today, we started at red flag number 1, and we're working our way to number 9, correct?
Well, we actually got to number 6 as far as clinical indicators. So you have behavioral, that's sort of surface.
No, but I mean, we started at 1 in the last episode, and we're working our way up to number 9, correct? And that, I don't think I've heard you...
We circled back around to behavior again.
Okay.
And so people just have to stay tuned. So I really wanted to do, and Ann and I will continue to do a comprehensive look at the behaviors. So I thought, you know what, there's too much there. And the difference really is this, what we see on the surface and what's driving it, or what's under the surface. So we got to number 6 of the clinical indicators because we did the behaviors. But then I thought there's still too many behaviors. So we cycled back around, we're looking at behaviors, and then we'll pick up the last remaining 3 of the clinical indicators.
Sure. And what I'm trying to get at, actually, and it's not so much a question, is I'm just looking for a real quick answer, which I think I'm going to get. So we start at 1, we're heading to 9 on various things, but the reality here is they get more deviant as we work our way to number 9. Isn't that correct? That transitions to worse and worse and worse. And now we're starting to get into the really, I'll say, deviant stuff.
Well, we will, but for the rest of the indicators, it's just kind of a shotgun approach. We're just throwing things out. But once a child starts again, once a teen, because it's going to start as a child, and then especially if you see a young child abusing an animal, right? That is such an indicator that something is going on. You have a troubled child on your hands. So if you see a child that is harming the family pet, folks, that all parents need to know that, again, quote unquote, boys will be boys. We understand that. But if you start to see a child that is starting to take delight in, so not only are they becoming more callous and indifferent, but they're actually now inflicting pain on an animal, you have a serious issue on your hands. And so that needs to be something that parents really need to take seriously and be mindful of. And the majority of serial rapists and murderers, that's true. As far as the impulsive kind, or the lone wolf kind of guy, inevitably now what I mean by sophisticated versus impulsive, and we'll go into this as well when we deal with predators, right? The impulsive one is they have a method to their madness, but it's not sophisticated, and we'll define the difference. So when you have the Bundys, when you have the Dahmers, that wasn't sophisticated. It did damage, but wasn't sophisticated. What you're going to find in some of their backgrounds, and especially the ones that will create terror, is you're going to find in the teen years early on, you're going to find cruelty to animals, or you're going to find that kind of stuff.
Yeah.
So
that's extreme. It's extreme.
And that's extreme.
And I think we're going to, John, I think we're going far too deep in this series to talk about that.
So that'll be kind of for later on. So people will know that we're really starting a series that'll continue now. Ann and I, we've gotten Ann off the book tour trail, and she and I, for the next number of weeks and months, quite frankly, we're really going to go in depth to how to help wounded teens, and then how to look for predators, and then the warning signs of young people that may in fact be heading down the wrong path.
The more information you have at your availability, the smarter you're going to be. The smartest person in the room is the one who has that information, and this is what this show is all about, is getting that information and having it come from professionals like yourselves, where we can definitely help any grandparents and parents out there that are dealing with a trans child, somebody who's been groomed, somebody who's been manipulated. And again, that word trans, I use that very loosely. Like you have said earlier, it doesn't really exist. So,
and Brad, if you don't mind, sorry, just so everybody can kind of have a sense of what we're talking about versus what we're not. I'm not really as concerned about, though professionally I deal with sex offenders all the time. The likelihood that somebody's going to encounter a serial rapist murderer in the trans movement is less, in a way. Okay, but what they will encounter are sophisticated predators that have figured out the loophole, which is, all I have to do is say I'm a female. Now you're going to let me into the women's locker room. You're going to let me into a female prison. You're going to let me have access to your kids. Those are the ones that we need to be concerned about. And those kind of guys, by the way, typically were not abused. There you go.
Very interesting. Till next week, hey?
Next week.
A cliffhanger.
Next week, I think maybe to start the show, we could bring in a topical, relevant topic. Not that this is all isn't relevant, but a relevant topic, because I think we're going to get a lot more information about the assassination attempt on Donald Trump. And I think that is going to open up a can of worms with the individual who was doing that shooting yesterday. And I think that there may be some reference that you guys will have access to down the road here to help others understand what just transpired, and how that, again, is... Again, we're going to have to try to unmask the trans movement, and it's happening in a variety of ways. And it first indicator was that somebody here is on the left, and they're trying to hurt the leader of the right. And we have a pretty serious incident. And there's some trans talk that the individual was that sort of I guess, in that sort of situation. I'm only going by what I'm reading on the internet. Over the next couple of days, next week or so, I think we'll get a better picture. A lot of speculation coming out in the first few days. I don't know all the details. I don't know what's right and what's wrong at this moment in time, what's true, what's false. But ultimately, there's been a lot of situations over the past couple of years that have resulted in mass murders, and they've been committed by individuals from the trans movement. Fair to say?
It's toying with troubled kids, and once you do that, whether behaviorally or you groom their minds or you actually put them on pharmaceuticals, it's a toxic cocktail. It's very dangerous.
There's lots to talk about with all of this. We're going to get to it all as we continue with this. Please join us next Sunday night, 9 o'clock, right here Eastern Time. John, you and Ann again next week. No special guests coming in, just you and the co-host.
I'm going to tell her she can't go on book tour anymore. No more writing books. But she's writing another.
I'm just writing now, no tours.
She's currently writing another one. But she's going to be with us for the next few weeks. We have told her she has to stay put.
That's great. Well, you guys have a great week ahead. We'll see you back here next Sunday night. Thanks to all of our listeners and our viewers tonight. Remember, it's not our kids' fight, it's our fight. So get out there and join the fight and try to help make a difference in every child's life. Till next week, we'll see you soon.